leadership's a big deal. That's why we have conversations. I think getting leaders who can really, we have the what I call the brain power to do things if we can get people focused in the right direction, get less focused on personal issues and get more focused on how is this going to help the community? How's it going to help my neighbor? What are the ultimate outcomes?
Hello, this is Marco Rock. Welcome to Marco Rock TV. I am Marco Rock, your host for Inside a Growing Mind, where we interview entrepreneurs, author, game changer for the sole purpose to inform and inspire you. Today I'm so thrilled for my guest, Mr. Ian Vickers. How are you?
I'm good, Marco. Good to see you.
Good to see you too.
Yeah.
So tell us, who is Ian Vickers?
So Ian Vickers is, well, my current title is CEO of Global Partners in Hope, and we run a nonprofit, but my background is international. I grew up in a bicultural home, born overseas, and
Where overseas were you?
I was born in Europe, in Germany,
Okay.
and then my mom's French, 100% French, so that's a little bit of the connection to the French language,
Okay.
and my wife's from Brazil, so
Interesting.
we have a very international, I've always liked traveling, had a passport from the time I could walk, so.
That's good.
Yeah.
Yeah. So you say you're CEO of Global Partners in Hope.
Yeah.
So what is Global Partners in Hope? Yeah.
Yeah, we're a nonprofit. We exist to develop communities across the globe. We work in Africa, primarily West Africa, but also do community work in China as well. We do leadership training. We put in renewable energy sources into disparate parts of the world. We put in health centers in places where there are no health centers, and clean water wells where there are no clean water wells.
So how does the idea of Global Partners in Hope came into existence?
Yeah, so it was birthed out of a vision by myself, or with myself and with several of our board members.
Okay.
That came together with the idea of creating a nonprofit that would create sustainable solutions. In other words, putting in community development projects that would not ultimately be dependent endlessly for sourcing or resources outside of the country. So kind of jump-starting either healthcare systems or leadership development programs that would be sustainable.
Okay, so you talk about healthcare, you talk about leadership development, talking about water. Which one, what do aspects focus on the most? Or do you think all are necessary to the development?
Yeah, I think when you talk about the development of a community in some of these parts of the world, you need the basic elements of life. You need clean water, you need food, you need health care, and then, of course, you need good leadership. These are what I would call basic elements of life. You take out, and then you start to get into other elements like electricity and those types of things. But for sure, clean water, for sure, food, for sure, good health. And then historically, communities always develop once those infrastructures and systems are put into place, and the community can support it.
Yeah. So as you work globally with your nonprofit, what are the opportunities and challenges that you face part of your work?
So we're in West Africa. The challenges is that the needs are enormous. Wherever you go in West Africa, you can see once you get out of the capital city, things drop off the grid pretty quickly. And so it's an issue of equitable distribution in our world. We have the resources, but we've got to figure out ways to make it equitable and to distribute those resources like healthcare, like clean water. And I know there's a lot talked about in terms of Africa, but we face the same challenge that everybody faces, being able to put it in a community where it'll be sustainable.
So why do you pick West Africa? Why not East Africa or North Africa? Why the need to focus on that?
So part of our strategy is that we'll work with people within the country who have a level of influence that will partner with us.
Okay.
And so a lot of it depends on leadership. I mean, we feel like everything kind of falls or hinges upon good leadership.
Yeah.
So when we go into a country, we've got to find good leadership that's going to really partner with us. We're not creating systems of enablement or doing something that someone else can do.
Yeah.
So
that's
yeah.
kind of the idea behind.
Yeah, so the reason we're in West Africa is because we've primarily, the countries we're working is because of the good connections and the leadership that's in place to help us
Okay.
partner with them.
Yeah. So what are the projects that you're currently working on you want to share with us?
So right now we're in a project that we're doing in Togo, West Africa, about 50 kilometers outside of the capital city of Lomé. We've had good connections with the officials in the country as well as local leaders, and you get outside of Lomé and the needs are pretty drastic, and the resources are just limited, like all of us. So that's where collaboration comes in to help, resource in areas where others can't. We have a full-time pediatrician and his wife who are there helping to do, pull together a medical team, do some education, but also put together a structure that would respond to the needs of that community.
So I understand, you have the same model in different countries called Mali. What are the impact, have you guys seen to
Sure.
the project?
So in our last, say we did some stats on the last 3 years, we've realized that about 393,000 people have been through these health centers.
Okay.
So they've been treated, and these are places where there was nothing before,
Okay.
at least. And we know that out of those health centers have been 23,000 healthy births. And so
Is that in terms of how many years?
that would be 2013 to 2018.
Okay.
So 2013 meaning the very, very beginning.
Okay.
Just starting. But then it gained momentum, really, I would say, in 2015 and 16, where it started to really kind of exponentially start to take off. Yeah.
So it was just like one big health center, or just like a different size?
Multiple health centers that are very sustainable. So sometimes you can build a really great building, a huge building, very impressive, but it's hard to maintain, hard to sustain, hard to staff. So we've created a system where you have these smaller health centers. They still are able to be efficient and we focus primarily on women and children, healthy births, healthy deliveries, healthy children, up to the age of 5. I mean, there's other things that are done in those health centers too, and we don't call them clinics, we really call them health centers. Yeah.
So what is the outcome that you and your board are expecting to get out of this work that you're doing?
So when we look at stats within a country, for example, in certain West African, for every 100 births, you're going to have pretty shocking statistics of 5 deaths from the maternal deliveries. There's going to be 5 moms that will die in that birthing process. So our goal is to reduce that maternity death rate and increase the life rate of a mom who goes in and does delivery. So in the region we've worked in specific areas, we've reduced that by 85%, and in a year, just by having the health center there and operational. So out of 100 deliveries, in our last statistics only had, out of 100, only 1. But that's a lot of times because it's still new and they come later. Yeah. So that's the impact that we're hoping to have, is that healthy kids, moms that survive, and are able to continue.
That's pretty cool.
Yeah.
So what piece of advice you may have for somebody who, for instance, wants to start a nonprofit or want to make a positive change in this region, for instance?
I would say that, make sure that you have a good board of directors behind you. A lot of times you can have an idea, but if you don't have the synergy and the community around to pull that off, it can be pretty frustrating. So the idea is to make sure you get a group of people who are not just thoughtful of the idea, but actually engaged in making a difference, helping to develop that. And so that's, for us, our success lies around our connections, our networks within the community, and our board of directors that are highly engaged, and the community of people who are supporting this work. We continue to grow that community, and we have a great culture and a great community behind this project.
So now you did some work in Mali, you are now doing South Togo. Were you thinking about that country in the future? And in that region you want to get into?
Yeah, we'd love to go and just synergistically build off of these relationships, whether it's Benin, whether it's Côte d'Ivoire, going into these other areas, specifically because we're leveraging our connections into West Africa, our understanding of the culture, our understanding of the relationships within that region.
That's pretty good.
Yeah.
So if you have a power to make one positive change in the world, what would that be?
Yeah, that's a great question.
Just one.
Just one.
Just one, yeah.
Well, if I had one, in terms of, I would say if everyone could have clean water, that would be a great start.
Clean water.
I think that's our starting point
Okay.
for me.
Okay.
And as simple as that seems, I think we'd be shocked at the amount of people that struggle with that every day in parts of the world that we take it for granted. But there are a lot, and I've been to every continent except for Antarctica. But I'm amazed and sometimes shocked at the lack of clean water in different parts of the world. So if that was one thing, yeah. And then, well, now see, you got me going because it's hard to go one.
Yeah.
I think leadership's a big deal. That's why we have conversations. I think getting leaders who can really, we have the what I call the brain power to do things. If we can get people focused in the right direction, get less focused on personal issues and get more focused on how is this going to help the community? How's it going to help my neighbor? What are the ultimate outcomes and the impacts that we're going to have within a community?
Yeah, because I think the truth is, if you, let's say, have those hospitals, have those stuff, you don't have good leaders to take
Exactly.
care of them or to share the vision. I think sometimes can be a problem or keeping those stuff.
Yeah, and I think if I could change one thing about humanity,
Okay.
which is even a bigger question, I would say upping the level of compassion and empathy is a big deal. I think that's a conversation we talk about. Our own values are trust, compassion, stability, and hope. Okay. And compassion and hope are so important for people. Yeah.
What would be your last advice or tip to my audience?
I would say that wherever you're at, wherever you're working, whatever community you live in, look around you and get involved in the lives of people who are looking for compassion and hope. You know, I mean, that sounds like a idealistic thing, but I think you can drill down into that and start to look at practical ways, simple ways to just help people around you. And it's obviously a driving passion for me. I mean, that's what we spend our day talking about, is how to help people. Yeah.
Mr. Ian Vickers, thank you so much for your time.
Thanks, Marco.
I appreciate it.
Yeah.